Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Doctors. This is a good article to start off with. That federal agencies going to bar Black History Month, kind of late because it's already February, and they wanted a pause of all activities related to Martin Luther King Jr. Day a little late. Juneteenth, LGBT Pride Month, Holocaust Remembrance Day, and other special observances. It's kind of interesting that they would start off with that. It's going to be interesting to see how the justice system responds to some of these challenges, because many of these things are implemented not by the president, but by the Congress of the United States. And so some of these things that he's talking about are actually illegal. And so it's going to be interesting to see how the courts will respond to these changes. Any comments or thoughts about these democratic processes?
Oh yeah, there's already a motion to impeach Trump already.
Dr. Perez, you have your hand up.
What do you expect? You got a thug in the White House, okay? He's been convicted of 34 counts, and there's so many others he's indicted for. So I mean, this is just absolutely ridiculous. It's absolutely ridiculous. But one thing, and this goes back to the first article, um, uh, we used to have a wire, because if somebody transitioned in the Black community, it could be around the world in 24 hours. And I don't know if everybody knows, but there is, for March 5th, a scheduled boycott of Target. So I'm just dropping that. I know there won't be a published article on that until it takes impact, but it's important. I think the reason for it, so that if you have to go and pick up your Navage kit, pick it up before March 5th or get it from someplace else. And I remember the A&P that used to exist, Operation Breadbasket. We closed that store down. This is absolutely ridiculous. The fact that you're gonna eliminate us and eliminate other people just by the right of your pen, it's confusing. He's crazy.
Well, it's just illegal.
And so, it's illegal, but he's a felon. I mean, he's a thug.
Well, but while that's true, it's still, if it's illegal, then the system should deal with it. And if it doesn't, then our democracy is past history. Which some would say that occurred as soon as he took over as president. But anyway, there's going to be an interesting response to all of this activity. And one of probably the best thing that happened is he did it right away, because when he did that, he then opened the door for people to accuse him of doing illegal things right off the jump, which he might have taken time and done it the right way, going through Congress and all that stuff. And they control the House and Senate, so he could have done that. And that might have been wiser. But it's going to be interesting to see what happens with all of this activity that he started so early, which may be part of his undoing. But we shall see. He had several efforts to impeach him the last time, which were unsuccessful. And this one is
He
likely
was
to be
impeached
successful.
twice. He wasn't removed from office, but he's been impeached twice.
Right, he was. Right.
Impeached.
Right, you're right. He was impeached.
He's stacking them up. He's going to be the most impeached president ever. What?
Well, he's already the first felon who was made president, so he has a lot of work.
He's already the most impeached too. No one else has been impeached twice.
Now, how do you do this as well? Sign Black History Month proclamation while you're also asking to do away with it.
Well, I think what his concept is to separate the celebration from government. Okay, having the government of the United States not support anything that gives us a break as Black people, but saying it or being supportive of it otherwise looks like, but I don't know, it's crazy making if you
Well,
think
it's just hypocrisy.
it's really
And so,
nuts.
and it's also very confusing that you would sign a proclamation after you've already banned activities celebrating it, whatever the reason you have for it. And then, of course, all these other observances. Of course, it's going to be interesting how the Jewish population responds to Holocaust Remembrance Day, as well as the others. So it's going to be an interesting first year and 4 years of this administration.
And right on the heels of that is us.
Yeah, and this was a magnificent celebration that Darrell captured in his Black Health Matters. And we were mentioning that the app, in conjunction with this, could be put on the scheme so you could see all of the pictures as well as the other activity that was involved in the Howard University Transplant Support Group that was started 50 years ago. And we have a lot of pictures and other things that really document all of the things. This is a history of our story, how we got started, and how we really started this off, because we recognized that the surgery alone was not enough. We needed more to it. And you can see how the group started off with the distinguished psychiatrist Elise Galati. Story I often tell about Elise Galati is he's an eminent psychiatrist and Christian lady. And I was telling this story during the celebration, but I didn't get a chance to finish it. But we had a patient who had difficulty having an erection, and because of his end-stage renal disease. And he decided to have a transplant because he hoped that he would be able to again have erections. After the transplant, a couple of months passed and he was still unable to have erections. And he was very bitter about it. And he actually came to the hospital with a gun to shoot Dr. Dillard and myself. And Dr. Galati met with him and got his gun and kept him from shooting Dr. Dillard and myself. So early on, and we've had a number of patients who've been dissatisfied. And, but of course, he's the only one that really came to the hospital with the intent to shoot Dr. Dillard and Dr. Callender, and Dr. Galati's intervention took care of that one. And then, of course, you see all the other, the team that we had put together. And then we've been able to publish a number of papers on the group. And it's time for us to present another paper identifying the fact that 50 years later, we have evolved into what we're doing today. And that's a paper that we need to start working on this year. Because this is something we started in 1975, and here we are today, still moving on, but doing it differently. So, any comments about this interesting history, Dr. Perez?
I think here we see it mainly in transplant, but I mean the whole revolution that you and the team enacted, and I say enacted. I think of Dr. Kuntz. You know, in the book Ecclesiastics, in the Bible, it talks about seasons, and just like this transplant support group that I get to see every Thursday, there is no mistake that we are meeting now. We might just be here in the DMV, or well, we're really across the country, but I mean that we're meeting now, that history is important, that the story, I never knew. I remember mommy or talk about the fact that Dr. Callender had to have a detail. And I didn't understand. I said, he's not a street man. He's not selling drugs. Why does he need a bodyguard? But we all do. That's what you had security. You had security. And I mean, it's outrageous. But the point was that you emphasize, you with your expertise says we cannot just treat a body. We got to treat a mind, we got to treat a soul, and we got to treat the family, the community, the collectiveness of it. And I will never forget one of the support transplant in-person meetings where there was this man, I don't know his name, and his wife. And they had gone to either to Georgetown, and they allowed him to get so sick. They were waiting until they put him on the transplant list. But it was the plea of his wife. And they had been there, maybe they had met you 2 or 3 days later, and he was having a transplant. It was the same story that Dr. Tatum was talking about at the anniversary, that we were left, we Black people who didn't come in with a millionaire status, who waited until their levels, their kidney status was so bad that a transplant could possibly been unhelpful. So I mean the opportunity, the support, the mandatoriness of knowing that it's not just the treatment, but in Howard University's transplant, you are going to be healed. You, your family. We heard about Uncle Clive, right? I mean, that's important. Sometimes when you don't want to get up for yourself, you get up for other people, your team, your community. That makes a tremendous difference. So the things you started way back then, 50 years ago, and it started with transplant. It's now what we do in pediatrics. It's what they do in obstetrics and gynecology. It's what we do everywhere. So I think you, Dr. Calendar, your team, all the people who hung in there deserve a resounding standing ovation because you're off the chain.
Well, thank you. I thought that's what you did last week, but thank you very much. And I think the fact that we're now spending our time to educate the community is something that is critical. Betty, you had a comment to make?
And okay, yes. Yes, good morning, everyone. I'm just so happy to see this history here. I was talking to you last week about was the history written down, and you told me yes. But when Dr. Perez was giving the history last week, I don't know about the rest of the people online, but I couldn't hear her. So I'm just happy to see that the history is written here so I can capture it whenever I want to look at it and see it. So
Thank you very much, Betty. Okay. I guess we can move on to the next, unless there are any additional comments. Oh, this is an article. I thought, we've talked about this new wonder drug for the 21st century, and Dr. Perez has had some interesting comments about it. And one of the things that is important is to recognize that this is a wonder drug, and that it has the opportunity to affect many different target organs. And the first question is maybe, how does this work? And it's interesting because it triggers the production of insulin and slows the release of the hormone glucagon, which raises the blood sugar levels and delays digestion, so glucose is released into the bloodstream slowly, and improves how the brain processes feeling of fullness after a meal. It means makes you not eat so much. Additionally, it has powerful anti-inflammatory effects. John Buchanan had asked him, what is this inflammation issue? And inflammation is the process that is involved in just about every disease entity. It's inflammation that causes much of the diseases. And so the anti-inflammatory effect is something that would be helpful in any disease in which there is inflammation, or just about every disease has that. So that this is an anti-inflammatory medication that acts in many different areas. And this is just a list of the areas that the medication, it reduces hardening of the arteries, which is one of the commonest problems of all. They call it arteriosclerosis, lowers the blood pressure. And as we know, cardiovascular disease is the #1 killer in the world. This is interesting, treats Parkinson's disease and memory disorders, controls diabetic neuropathy, reverses liver disease that were formerly considered irreversible, slows the progression of chronic kidney disease, treats diabetic kidney disease, reduces the risk of Alzheimer's, actually can treat depression, can combat drug addiction, can also decrease asthma attacks, and improve symptoms of inflammatory arthritis and rheumatoid arthritis. So this is why I've called it a wonder drug, because we have evidence that this acts in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 ways in which it is beneficial. Now, the cost is an issue because if it's not covered by insurance, you could spend $1,000 a month. But of course, Blue Cross, Blue Shield, Medicare, Medicaid, and Cigna cover it. But one of the things I close with is that point out that this does not replace the need for regular exercise, for regular meditation, for eating a nutritious plant-based diet, taking prescribed medications, and following your doctor's recommendations to maintain your overall health. So we share this just so that you be aware that this is coming down the pike. It's not as well known as it will be in the near future. Any comments or thoughts on this GLP agonist that has taken the world by storm?
Yes,
You know,
you answered my question. I said, I guess you kind of answered my question, Dr. Callender. It's not readily available right now. Is that what you're saying?
it is available now, but
Oh,
it's available for the treatment of obesity and for diabetes. It is available, so it is FDA approved, but it is approved for the most part for diabetes, especially if insurance is going to pay for it, for diabetes and obesity. The other issues, doctors can use it off label for the other issues. And remember, we had an article that talked about using it to prevent Alzheimer's. So that, yes, it's available, but it does have a cost if you don't get it covered by your insurance company.
and it's GLP-1, is that?
The GLP, the category is GLP-1 receptor agonist. That's the name of it. But it is available and it's FDA approved.
Okay. Thank you.
Many doctors may not yet be aware of the wide-reaching benefits, and that's why I share it with you, so you can interact with your doctor as necessary. This is an article that similarly identifies the wide matter of ways in which people have used this drug for diabetes, and more than 2 million people with diabetes have been treated. Well, the problem is that we don't have long-term studies yet. We have short-term studies because it's really only been used since 2021 for the most part. And so we don't have long-term studies, but we've got the 1 to 3 year studies that are able to identify its strengths and its shortcomings. And this article goes into detail to identify all the many ways in which the drug works, just as the previous article did, with data supporting all of that. So as you go down the list, you'll read how the key improvements included reduced risk for substance use, alcoholism, opioid, suicide ideation, seizures, Alzheimer's, and the same dementia, the things that we talked about already. In addition, since it's anti-inflammatory, anything that causes diseases, it certainly has the ability to overcome it. Last to be appreciated is its impact on the brain and the fact that it may help prevent progression of Alzheimer's. And so I think this maps it out so that you can see that this is the drug that affects virtually every organ system. And so this is something that you need to be aware of, as their doctors are aware. And as we get more data, we can know more about how it's beneficial, as it points out later in the article, that there's some low incidence of pancreatitis associated with it. And there are some other side effects of nausea, but usually if you stay within the dose that is recommended, most of the side effects are mitigated if you eat a proper diet. And because one of the things about the drug is that it affects your appetite. And therefore, if you don't eat the right food, you can have what we've mentioned many times, losing the fat, but also losing muscle. And you need muscle. So this is the way in which this drug works. And so I thought it was important that you know about it, because we're going to be reading more and more about it every day. Any comments?
Dr. Callender, does it help with both types of diabetes, 1, 2?
This is effective for proven definitively for type 2. So far, even though we know or we believe that type 1 is a consequence of an inflammatory process that has wiped out the beta cells of the pancreas, it has not been effectively used for type 1 diabetes. Type 2 is the diabetes for which it is most successfully used. Now, this is another GLP agonist that has had no safety concerns. And so as we get away from treating diabetes and only treating obesity, this is a drug that, and they call it incretin-based drugs because incretin is the GI hormone that is produced in the intestine that these drugs are based upon. So, and so the greatest use of these drugs has been for diabetes and obesity. So, any comments or questions about this? I think Dr. President mentioned that this is an opportunity for medical schools, HBC medical schools, to really study these drugs and see how this impacts our ethnic group as well as other ethnic groups. No such study that I know of has been carried out.
Are you using the word diversity, equity, and inclusion?
Sure. Why should we not use those words? I think that's
No, we
what
have to. That's the fight back. That's the pushback. And
yeah,
and
well,
so in
mhm.
many of the areas that this drug is the GLP-1s are being effective in are areas in which we are disproportionately impacted.
That's correct.
And likewise though with these big pharma, they have not talked about, which we usually do in research, increasing the number of people who are disproportionately impacted by a disease condition in your research.
Well,
I do not see that is part of the movement forward as it relates to GLP-1s. And that's critical. were disproportionately impacted by diabetes, by hypertension, end-stage renal disease, Alzheimer's,
Well, so
liver
therefore,
disease.
yeah, so therefore, as suggested, we should take the ball and run with it. We didn't need anybody else to do it. Now, Big Pharma has had an increased effort to increase the number of minorities in all studies. It just as the same thing is happening with the artificial intelligence, because there's many who are working to ensure that people of color in all communities are involved in all aspects of artificial intelligence, as well as all new therapies. Because your point is very well taken that all of these involve areas which people of color are particularly affected. And so we have to maintain vigilance in terms of holding their feet to the fire, regardless of what people say about the terms, because they're critical. What has made America great in the first place is its diversity. That's what saved us. So for us to now at this point to abandon diversity is unwise. Any other comment before?
Yes, I just wanted to point out that, you know, in many cases, we have discovered that our diversity, as Dr. Perez has pointed out, our diversity is the strength of our country. And when you try to deny it, that's based on fear. That's based on, well, I'm not going to be as important as I was. Speaking of certain, folks in this country, they're afraid that they're going to lose their importance. I think they're trying to, bolster up the fact that they're in charge and they run everything, and they want to continue to run it rather than to give it up and share that power with everybody.
Any other comments? Well spoken. Any other
Yes,
comments?
it's not share. Every opportunity where the door has been open for a Black person, we, with all of the oppression and all the weight that has been put on us, still exceeds. I mean, that's it. They're scared of us because
Well,
we beat you down and still you rise. We beat you down and still you rise. What? We
well,
give you inferior education and still you rise.
well. I just would hasten to add that that's true of us, but it's also true of other ethnic groups that have come into this country and are now being beaten back similarly. While it is eminently true for our particular group, it is true as well for other ethnic groups who will feel the brunt of these efforts to go backwards as they try to keep America white. Inevitably, by 2045, whites will become the minority group. So whether we like it or not, all of these efforts, and that's why they're aggressively moving now, all of these efforts are likely to be in vain. And therefore, the aggressiveness of their actions at this point. It may well be too much, too little, too late. But it's something that they're still moving forward aggressively.
And the name not heard, just for history's sake, Francis Cress Welsing in the ISIS papers was the person who first presented the idea of replacement theory. It wasn't called that, but it was the same principle. Francis Cress Welsing, the ISIS paper, Black psychiatrist.
Right. Okay.
Like Dr. Galati. And like your paper. No, it's important. It is so important that we know our history.
Right. That's the one thing that they can't take from us. So, one of the things is most of us grew up in southern countries and southern states. They got Black history. In in the eastern part of the United States and the north, history of Black people was not taught. So that's why some people say one of the worst things that happened is integration. But I'm not sure I would agree with that's the worst thing. But one of the things was that with segregation, our history was kind of, even though nobody else knew about it but us, because the American history didn't have us included. But now, as a consequence, we have to record our history, as Betty is talking about. And to that event, that's why I've been so prolific in writing papers. I have about 150 papers to my credit for that reason, because I think it's important to publish, so that the history will record what you've done. And this is true for us as well, to document the fact that, yes, still we rise. This is, in case you didn't know it, the number one infection in the world today is tuberculosis. And in Kansas City, Kansas, they had an outbreak of TB. Of course, that's when you recognize that TB is number one killer and infection killer in the world, you realize that this is something that's very important. And as they talk about in this article, it was particularly in the homeless population that this infectious disease was growing. And we do have anti-TB medications. And we do have a treatment for it now. When I was young, they didn't have a treatment. Now we have a treatment medication that will cure it. So it's important to know. And cough, chest pain, fever, coughing up blood is one of the best ways of, when you have that's one of the reasons to think that you have TB. Getting it treated is important. Any comments about the change from COVID being the number one killer to TB being the number one infectious disease killer?
Dr. Callender, they mentioned 109 cases actively happening in Kansas. But what are the latent cases and how do they find them?
Well, latent cases, that means you don't have any symptoms. So that you may have you may have had it, but you took care of it yourself. And so you didn't need any treatment. Of course, some of those people, they may decide, the doctors may decide to treat them anyway, just to make sure. But that's what the latent cases, they didn't have any of the signs and symptoms of the disease, but they were found to have had the disease.
So that reminds me, sometimes you have applications for certain jobs. They want you to get tested for tuberculosis.
Right.
And
you might be positive.
You can spread it as a latent?
No, you can't. But it's important to know, because In some instances, they may want to treat you anyway. But no, you can't spread it if it's latent. It has to be active for you to spread it.
Dr. Calendar, is this disease particularly hard to detect?
No, it's easy to detect because we can do X-rays and we have TB tests that can identify whether you've had TB or not. It particularly affects people of low economic strata, people who are homeless, who live in shelters and those kind of things. Or if they have immunodeficiencies. This is an article that talks about the bird flu, avian flu, and being found in poultry. And many are concerned that this will result in another pandemic. And so this has become an important disease to look for whenever you have somebody who has COVID or anything like that. Okay, if any comments, let's go to the next one. This is an article on isometric exercises, and we have in the past talked about it. This is where you sit and you don't do the so-called active exercises, and you contract your muscles without having those so-called vigorous exercises. But weightlifting and isometric exercises are good ways to add to the aerobic exercises. And particularly people who have impediments to moving around. These are exercises that have been proven to be good for your health and for your heart. And it emphasizes the importance of the muscles and the ability to compress the blood vessels, and how this, along with the nitric oxide that's released, dilates the blood vessels and helps lower the blood pressure.
That's a great picture of a plank. They're fairly easy to do. If you have any elbow problems or any problems with carpal tunnel, you just put some pillows under your elbows, and that'll reduce the strain and the pressure. But planks, especially if you can do them up to 60 seconds on a daily basis, will reduce blood pressure.
Thank you. Any other comments? And my daughter, she goes to do these exercises twice a week. Stretching, planks as they call them. Yeah. Next article, please. It's an interesting article that burgers and fries have nearly killed our ancestral microbiome. It talks about how they looked at the intestinal flora of and looked at people who have the Western diet and those who have the Eastern diet, and have identified a difference in those who have relatively healthy diets and predominantly vegetable diets and those who have the meaty diets. And although they are different, it is still felt that the healthier diet with the plant-based diets particularly are more desirable than the others, although they did not decide that we were going to die because of the Western microbiome, but it certainly is less healthy than the Eastern diet. They talk about the importance of fiber again, and talk about the absence of fiber is extremely unhealthy. And the presence of fiber, meaning whole grains and vegetables and fruits, makes a big difference. And it's interesting, a lot of the results they base upon mice experiment, as well as human microbiome experiments.
Yeah, that was an interesting comment that the fiber-starved mice were meaner and harder to handle. That may apply to people too.
Yeah, yeah, that's right.
I
Well, I
know
think
when it gets backed up, I'm not nice.
Okay, all
I'm
right.
as nice as can be. I go at least twice a day.
Eating right makes a difference, huh, Darryl?
Yes.
Okay, let's go to the next article, please. This is an article that talks about the price we pay for these cross-country wildfires that start all over the western part and come, and also in the east, and affect us here in DC and Baltimore and other places, as well as in the west. Sometimes we forget about the eastern wildfires that we have, and it made it difficult for us to breathe here in DC. So this affects the quality, and we're talking about air pollution. This is what causes air pollution. And therefore, people with respiratory problems are adversely affected by all of the smoke and polluted air. All that stuff that happens in Canada comes down to us here. And I guess that's why, for example, you go to some countries, they all wear masks because of the air pollution. You know, when I went to Korea, most people were wearing masks because of the pollution, air pollution. Now, this is an aspect of the wildfires that we may not have recognized before, that it can increase dementia and other neurodegenerative diseases like Parkinson's disease. It's something that we don't talk very much about. We talk about Alzheimer's, don't talk much about Parkinson's disease. But those are the two, neurodementia and Parkinson's disease, two neurodegenerative diseases that we talk about that are common. what can you do about the air pollution, which affects all of us? You know anybody with Parkinson's disease?
My oldest friend.
Yeah, I've had a number of friends who've had Parkinson's disease. Although it doesn't seem as though it has affected our patient population, the people of color, as much as it does other people. It seemed to be much more common in other ethnic groups. They talk about wearing these masks. It seemed like almost everybody in Korea had an K95 mask.
You know, I was thinking about Muhammad Ali with Parkinson's, and I just did a search on are athletes more prone to Parkinson's disease? And it says yes, athletes who play contact sports like football may be more likely to develop Parkinson's disease. And of course, boxing and wrestling, those would be other sports very prone to head injuries.
Yeah, thank you.
So don't let your boys play football or go into boxing or wrestling.
But you know, on the back of that, we have to say, with the wonder drug, do we begin? I mean, we started making sure that low dose aspirin became a part of, as our blood becomes a more viscous and thick, that it is a preventive strategy that we're using ubiquitously. Now, should that be the same thing as it relates to GLP-1s and the preventative impact that it can have, especially because of the consequences that so many of the diseases, the chronic diseases that we have.
It's food for thought. We need to explore that aspect of it.
Well, you're in the academy. We need the researchers to put it together to look at that. Lucy Perez does not want Parkinson's. I do not want Alzheimer's. You know.
And I think all of us on this group feel the same way you do. What most people want as they age is to have a quality life, not have some of these neurodegenerative diseases, but almost all of them are associated with inflammation, which is associated with a diet that is plant-based, which is the one that is least associated and is the most anti-inflammatory. This is an article that talks about, in order for you to pay 7.4 billion, that means you must have made billions and billions of dollars. So they agreed on a settlement of 7.4 billion opioid lawsuit. That's an awesome amount.
When they had the last Powerball, what was that? That was just 1 billion. And I was excited about that.
Well, I'll take $1 million.
Excited for you.
Yeah, well, that 7.4 billion is over 15 years, so it's something on the order of 500 million a year.
Well, it's not like that's petty cash.
It's more than I
Right.
thought.
Amen.
Yeah. Okay.
I wonder how they would determine uh, who would get that money. It says it's supposed to go to states, victims, and survivors. Uh, how would you apply? Suppose if a family member had
I
been
have no idea.
by uh,
I have no idea.
drug. OxyContin. So many people are using it. It's available on the street corner there.
For a price. Yeah. Okay, let's go to the next article. As we have the public health crisis and the substance abuse crisis, this is an article that says we're not meeting the need for that most people who have substance abuse issues are not adequately treated. They're not receiving care. And of course, one of the requirements for all physicians is that you take 8 hours understanding substance abuse disorders and how it should be treated. And of course, alcohol use disorders among the commonest, along with the opioids. Of course, the difference is that the alcohol is over the counter, whereas the others are illegal. So how do we get expansion of this effort to take care of people who are addicts? We've got so many addictions these days. Sugar addicts, salt addicts, caffeine addicts, you name it. It's amazing that the number of addictions that we actually have to deal with. So it's not so surprising that we have not dealt with it. And some would argue that the reason we've dealt with it to the extent we have is because the majority of the population is now more afflicted than was ever thought before. Any thoughts on terms of what else we can do as so many of our people are addicted to substances? What role can the family play? Our children, grandchildren, or great-grandchildren? Any thoughts, any ideas, any suggestions?
Yes, maybe just being supportive and trying to teach them, but the younger generation don't listen like maybe we used to. When our parents talk, we sat there and listened. The younger generation, not quite like we were. So,
Well, one of the things that is problematic is if you go in any 10 blocks, you run into about 10 alcohol stores, even more liquor stores than churches. And so we contribute to it mightily. And we still say that it's okay to drink 2 or 3 drinks a day for men and 1 for women. But for some, if you have that gene, wondering starts it. And but we've catered to the alcohol industry and such. So.
Well, but back during Prohibition, when they decided to make alcohol legal, and they knew it was harmful, but they made it legal. And then now, the cannabis, and where it may have some health problem, may help you, but it also hurts you. But they've made it legal, and you can get it everywhere. And as long as these opioids and stuff keep coming in, I'm thinking 10, 20 years from now, it's going to be legal. Because I guess they realize we can't control it, so we might as well get tax from it and make it legal.
Any other comments? Oh,
Dr. Calendar, Betty said something, but I'm sort of this. They always point our generation as the most obedient, we listen, and etc. I have a contention with that. I don't think our generation really was that obedient, and we listen. And we listen as we became older, maybe. But as far as listening, the same techniques that we used when we were younger is the same. And you said a lot of people have the addiction problem, whether it's to sugar, salt, drugs. If there is a gene, you can become addicted to anything, and whether it's harmful or not. And I was thinking, did the study have anything, this magic cure to help people with their addiction problem, no matter what it is? Some people just have an addiction to even lie, but that's not a medical problem. But what is that magic thing to help people with their addiction, no matter what it is?
well, I think that they do. And I guess that's what this article was talking about, is that do you have the ability to take care of patients who have abuse problems? Because yes, there are services that are available, and there are medications that can be used to help people manage their addictions. But if they don't get to them, then they can't take advantage of them. In terms of the listening issue, it may be true that the older generation did listen because they were required to, because they had parents that stayed at home. Nowadays, you got parents who work in 2 to 3 jobs and they don't even see their children. They have somebody else taking care of their children. So it may well be, it may be true that he said that our generation listened because we were forced to listen. This generation, they have so many things going on. They got so many things going on, they don't have to listen. But they're listening to what's going on in the box they're looking at. They start looking at that box at about 1 year of age, and after that, they are more taught by what is in the media than by what their parents teach them. This may well be part of the problem, social media.
Yeah.
There was an article in the Washington Post that talked about for 1 month, try staying off of your phone and social media, and how good that would be for your health. And so anyway, that's another counter argument to that point. Any other comments, discussion on this interesting subject?
Yeah. When it comes to drugs, you just have to look at history. Okay, like I'm a baby boomer, so I remember marketing that came to the black community, and
Wow.
it coincided with okay, when I was growing up as a teenager, you could always get marijuana. Not everybody just because it's a thing in the neighborhood or in the culture doesn't mean that everybody's going to do marijuana. Some people will, but the more it's available, the more people that you're going to have that increase that particular type of drug use. There was a time when, historically, uh, it's the mafia in prohibition. The mafia was selling liquor. At some point, they diversified. In the 50s, mafia decided they were going to start selling heroin in the black communities. That's
Yeah,
when it became available.
yeah.
When I was in college, what became available when I was in college was cocaine. It was kind of unheard of until about 1969, cocaine. Uh, then the CIA started distributing crack in the black community, and that crack epidemic started in the 90s. Um, you had a lot when manufacturing. There were a lot of factory towns all through the United States, and it was mostly populated by small white towns that were factory towns. When those factories left, when they went overseas starting in the 80s, but those factory towns were mostly ghost towns where there wasn't jobs. The manufacturing companies had left, and so you had a whole series of young white people with no jobs, depressed, and they decided to start marketing opioids to that community. And so as it grew, now there's an opioid problem that they're trying to deal with because it's affecting white people. And that's why they're trying to decriminalize it. But there's just a tremendous amount of money in drugs. And I've seen it marketed where whatever criminal factions, they're trying to maximize their income. Like once one ethnic group gets tapped out, you say, well, we've got the most money out of that community. They move to another community. They kind of tapped out the black community on crack and heroin. Now they moved on to opioids and fentanyl and heroin with the white communities. But when that gets tapped out, they'll move to another ethnic group. It's an evil industry, but you say, why is it on the rise? As the wealth disparity gets greater, that means there'll be more people that are down on their luck, poor, depressed, and they're just excellent candidates for the next wave of drugs. It's all about the money.
John Tatum?
Yeah, some of those drugs that you all talk about are not illegal. And so to say that they're going to make them legal now, they're already legal. Oxycontin is legal. So is fentanyl. They're legal. The illegal part comes is when they are obtained without a prescription.
And that's the illegal part. There's fentanyl. That's brought over. They say that's brought over from South America, and so that's some illegal distribution. There's a lot of doctors and pharmacies that are dispensing the OxyContin without prescriptions, and that's being traded illegally.
Any other comment? Okay, let's go to the next article. And this is about the fact that anti-inflammatory therapies tend to reduce the risk and incidence of Parkinson's disease, which goes back to what we talked about earlier, the fact that these degenerative diseases, most of them are inflammatory diseases. And so medications that are anti-inflammatory are able to decrease the likelihood of these inflammatory diseases. And so when you have medications like, as we mentioned, the glucagon derivative, the fact that they are anti-inflammatory suggests that they may be helpful in the treatment and perhaps prevention of these inflammatory degenerative disease. And this study points out that there were statistically significant differences in these diseases when anti-inflammatory agents were used. And so there's just another hint that avoid inflammation wherever you can. And this class of anti-inflammatory drugs may well be helpful in a variety of organs and diseases, as we have discussed before. Any additional comment about this? This is something that we have wondered about, that the BCG vaccine, administering at the same time with the COVID vaccine, may protect against long COVID symptoms. This is something that phase 3 trial has demonstrated. And of course, long COVID is something that is very undesirable, and about 20% of the people who get COVID have this long COVID problem. And so there's suggestion that giving the BCG at the same time as COVID may be the way to go. As you know, the BCG vaccine is as old as the hills, but it's something that could be helpful in conjunction with COVID. Because long COVID is not fun, to say the least. Any thoughts or comments about this new BCG immunotherapy, which is old as the hills, but doing it in conjunction with the COVID vaccine is an interesting byproduct of what our research has demonstrated.
What does BCG stand for?
Okay, there it is.
Oh, okay.
Bacillus Calmette-Guerin vaccine. And it's a vaccine that was really used to immunize people to keep them from getting TB. And as a matter of the TB test is that you put this in the skin, and if your body reacts to it, it means that you've been exposed to TB. But that's what it is. This has not yet been used. It's just that the research is suggesting that this may well be what we'll do in the future. But this is the first study that has demonstrated it. Patients with advanced CKD may experience reduced smell and poor nutrition, which is the last thing that you need to have for somebody with CKD. They need appropriate nutrition. And it's been interesting. We've had a number of people who had CKD who stopped eating meat and adopted vegetarian and vegan diets. And as a consequence, most of their symptomatology, everything except the kidney disease, disappeared. And even the way they dealt with dialysis was much better. So that the plant-based diet does have a difference, make a difference, because the diet is very anti-inflammatory, and CKD is a consequence of inflammation. Any comments about this? I think we'll have one or two more articles and then I have to leave. Let's go to the next one. I had a call the other day from somebody who works for CDC, and they say everything is frozen, CBC. Their morbidity and mortality weekly report is unpublished for the first time. They are able to communicate nothing. So this is something that's never happened before, but we're going to see a lot of things that didn't happen before to happen now. So this impacts CDC, FDA, and National Institutes of Health. And I think it's going to be radically changed from this point on. The FDA, the CDC, NIH will all be revolutionized. And of course, with the clearing of Kennedy for Secretary of Health, everything's going to be different. So this is just the beginning of a nightmare that we will see in front of our eyes. Any comments or any thoughts? Because this is what is happening, not conjecture. This is what's happening. CDC is incommunicative, period.
Dr. Keller, I'm wondering, what would be the logic behind this?
Well, I think the logic behind it is that he's taking over, and whoever's taking over for Secretary of Health is going to have a new CDC. You saw he's taking us out of the United Nations, out of World Health Organization. So it seems like it's his intent to rule the world. So that's my take on it. What are your takes?
Buckle up. We are in for a long ride. That's the best thing I can say.
And this is just the beginning.
Yeah, it's just the beginning.
Everything that has Obama. Any other thoughts or comments?
Yeah, it's part of retribution too. He feels like the
Yeah.
CDC and COVID was the reason why he lost the 2020 election, and so this was retribution against the medical community, and he wants the medical community to have to adopt whatever political agenda he has at the time.
Any other thoughts or comments?
But that's just it. He doesn't have a political agenda. He doesn't have an agenda. It's all about power. You know, it is.
That's his agenda, though. That's it. That is the agenda. Power. That's an important
Because
agenda.
when COVID was there, the mandate was to shut down business, to isolate, to quarantine, and that was bad for business because he measured his success on how well the stock market was doing.
Right. Any other final comment on that subject? If not, this will be the last paper we'll discuss. This is FDA, of course. We mentioned that FDA, CDC, NIH are now all silent. So you won't see much coming out until the new FDA, new CDC, the new NIH is done with. And we're talking about the importance of lowering nicotine. As Daryl had mentioned, in the 50s, 60s, 70s, and 80s, they were targeting us unfairly to smoke. And so now we've killed so many people because of nicotine that they're now finally trying to get them to lower the amount of nicotine because it will decrease significantly the number of people who die. Said it could prevent more than 48 million youth and young adults from becoming regular smokers and save 4.3 million lives. So it's a lot late, but it's better late than never. Although when I see what's going on in Europe with so many people smoking in Europe, I wonder why they haven't gotten wise to the damages caused by nicotine. Any other comments about nicotine and cigarettes?
Dr. Connor, before you go,
Yes.
we have a guest today. With the ending phone number of 5323. If they'd like to introduce him or herself.
Couldn't understand you. What'd you say, John? John, could you repeat that? I didn't understand you.
Yeah, do we have a guest today?
Do we have a guest today? I don't. I don't
With the
know.
ending phone number 5323. They'd like to introduce themselves.
Oh, are you still there?
You're
They're,
on the phone, they're muted.
they're muted. Yes, they're muted, John.
I know that. If they'd like to unmute and introduce themselves. Otherwise, Dr. Connor gotta go.
Okay. Any other comment on the,
I wanted to say about this article, my husband brought it to my attention that they may lower the content in the cigarettes, but instead of people smoking 1 pack a day, they'll smoke 2 or 3 to get their
Yeah.
their nicotine fix. So
yeah, sadly.
yeah.
Okay, this will be the last article of the day, and thank you very much for attending.